It's the show where Hawaii's newsmakers come to talk and to take your questions live. From the nation's capital to Honolulu Hale, from the state legislature to the fifth floor. We bring the experts to you and ask them what you want to know. Spotlight Hawaii with Yunji Denise and Ryan Pelesuji on the digital platforms of the Honolulu Star-Advertiser.
Well, happy Aloha Friday. Thanks so much for joining us here on Spotlight Hawaii. I'm Yunji Denise. Ryan has the day off. We continue on. We are talking today about COVID-19. It's something that many of you maybe have not thought about in a while, but still continues to impact our lives in so many ways. And so we have one of the best in our state and really in the country joining us this morning, Dr. Scott Miscovich of Premier Medical Group. Of course, he's done so much work, helped the U.S. Olympic team when it came to COVID testing, runs clinics around the country, and is generously giving us some of his time this morning. Dr. Miscovich, thanks for being here.
Certainly, Yanji. Anything I can do to contribute to help the people of our state, and I'm happy to be with you. And again, congrats for your wonderful work.
Thank you so much. Well, I want to start with where we are as a state on COVID. So much has changed, even just in the last few weeks. We saw on May 11th, those emergency declarations going away and that changing what's available now when it comes to free testing and other things. So tell us, as a state, how you think we're doing when it comes to COVID.
Well, in general, I think I have to take it one step up above, and I have to say, everything has trickled down from the federal government. So you have the federal government that stopped the emergency proclamation, and we all know that fateful day of May 11th, and that then gave directives down to the state, essentially, of what they were funding and what they were not funding. That's a very key issue why the proclamation ended. And the states then had the opportunity to take it and interpret it in the way that they individually wanted. And as you alluded to, I'm all over the country and I have people everywhere. And I can tell you, it's quite consistent. It's quite consistent that we're seeing the same things that are happening in Hawaii are happening across the United States, some a little more aggressively, some less aggressively, but just in general, we're seeing that happen. So now specifics. You have the free tests that are going from the federal government, mailing them to you. You have most of the free testing is being eliminated. I would say by the end of June or even July, a lot of it is going away. Most has already stopped across the country. And as we know here in Hawaii, we're really kind of at the end of the road when it comes to free testing. Then the next step you have to look at which is a very, very big issue, which is the masks and what are the masks mandating and where does that stand all over the country with different institutions. As we know, that has been sliding down and slacking. And then you get to the case reports. I can tell you, as you see, our case reports have been steadily coming down weekly. We still have a percent positivity that's up in the 6% range, depending on the island, which is still significant. You really want to see that percent positivity start dropping down below 5 as your first marker. And then below 2, you're really getting into a nice steady state where it's almost like just not going upward, is just spreading amongst the direct people, but not increasing. So we anecdotally, but I do have a good sample size from the windward population since we have an urgent care and I am back in the office Tuesday, Thursdays. We're still seeing a lot of COVID. We're seeing a lot of COVID and we're seeing a lot of clusters. And I am well aware that right now we have a major cluster going on at the very large nursing home on the Big Island on the Hilo side, 37 residents, a lot of staff. And, Yunji, when I hear that, that's where I stand up and I say, God, we got to protect our kapuna. So we're getting business clusters, we're getting family clusters, yet you don't hear that anymore. The news is over, but it's still happening.
Okay, and you did mention masks. One of the big things that changed with that May 11 emergency declaration sunsetting is the requirement for masks in medical settings. We know that a number of medical providers in our community have decided to make masks optional outside of the ICU. What are your thoughts on that? Do you think that that is a wise decision? Are you concerned about it?
Um, yes, I am concerned about it, and I can address this broadly. I can address it from the country, and I can address it here locally. And that again is, I think, the important way we have to understand it, that we're not just targeted here in the state of Hawaii. Back in one of my old haunts up at Boston and at Brigham and Women's and Mass General, where I had done a lot of my training, and that's a really blue, very, liberal state. They went wide open up there. I was very interested in that. And then you can go across the entire state of Michigan. I mean, so there are multiple places in the country that just, with emergency proclamation, just dropped it. And now we know here locally, I think one of the big issues is Hawaii Pacific Health has just made a public announcement that they are dropping their mask mandate. But I think we need to understand the details of that, because the first line news is HPH drops masks. Well, not exactly. You must keep masks in the like for chemotherapy. You have to have them in the ICU settings. You have to have them where there's any chance someone's immunocompromised. You have to have them where I think there's a chance of infection spreading. But in some of the general public areas, you're able to not wear masks. So it's a half of a mask mandate drop, but focused and targeted on the areas where there's potential risk. So my problem, just as a generality, and believe me, I'm not targeting HPH or any of our other institutions, because Adventist Health did the same thing, Castle. I think Queens still has a mandate in place where all visitors have to have it. In general, I just feel that healthcare institutions have to be a place of safety. They have to be a place where an individual knows going into the institution that there are people that are sick, right? You come to the hospital generally as an overview for some reason, and sometimes you're healthy. But there should be a feeling of protection. There should be a feeling that you're not going to get exposed and infected if you're a healthy person walking in, knowing there are people that are infected. So in general, with my offices here and anywhere, we completely have masks, and we completely use masks. We give masks to everyone if they don't have them. We train them on how to use them. And I do not plan on dropping that. I want to enforce the safety to the patient, because let's face it, there are people that come in that are sick. There are people that come in that are healthy. Why would you expose the two of them? The second issue, which is paramount, that does not get discussed at the national level and at our local levels as much, we are still seeing 40 to 50% asymptomatic positive. Okay, think about that. Almost one person for everyone that's infected is out there infected, spreading the disease equally, and we still have a risk of disease, as we saw our death rates fairly significant in the state for this last period, is the kapuna. Every decade, starting at 60, goes up. The death rate goes up. That has not changed from the beginning of the pandemic. And those are the people at risk. And again, we talk about immunocompromised. Those are the people at risk. So we have to protect them.
I think that there is a feeling that as we've reintegrated into whatever we call normal life these days, but as we've sort of gone back to the way we lived before 2019, before 2020, I wonder, a lot of folks feel like, well, it's just a cold. It's no big deal. If you get COVID, it's okay. What are your thoughts on people who say that, who feel that way?
I think that if you evaluate the data currently and you evaluate the data that goes at the different age brackets from the pediatric age groups to the adolescents, 20s, 30s, and keep going up, you can really look at, say, the last year in the post-Omicron phase or so, that the death rate and the hospitalization rate for the people who are healthy and not carrying risk factors, it's probably true. What they're saying is very likely true, is your chance of getting severe disease if you're a healthy individual. And note, I'm not even talking vaccinated. I'm talking just if you are a healthy person, your chances of getting severe disease is very, very low. It's very low to the point that in the recent FDA and CDC update, where we now have the bivalent vaccine available for 65 and above after 6 months, is they also put a paragraph in there that said, you know what, if you're like in this age group, we're not really even recommending, if you haven't got it, you may not have to get it. Essentially, they basically came right out and said, you may not even benefit or need to have another vaccination. So that's really an important point for me, but I've said this to you before, and I preach this again. The big issue is everybody has just dropped it, and no one pays attention to risk factors. A risk factor is being overweight. In the data that is run through CDC and all different organizations, the bar is kind of low. I mean, BMI 25 is pretty low, and that's where they start classifying you at being overweight or at risk. But as you go up to 30, BMI of 30 or BMI of 40, which it's not uncommon. That is not an uncommon number, and we see it in the practice. And then, of course, the blood pressure is eking up a little bit, and you can have people in their 30s like that or 40s. You're at risk. You are at risk if you get the disease. Now throw yourself out as a smoker. And if you've been a long-term smoker and you start to get a little bit of chronic cough, you're totally at risk. You know, anybody that has any type of inflammatory disease in the lungs is at risk. And so that category of that group in there is a group at risk. Yunji, the big issue has to go back to that where we started. 60 and above every decade, we have one of the highest percentages of multi-generational households. We have a true feeling of ohana in the state of Hawaii. So people really love and care for and visit, and families are here and get together. You could bring that disease into your family member. You know, we have 50 plus people in the hospital, and we have people in ICU, and the majority of those in ICU, I can tell you from the data, are older. They got it somewhere. They got this disease somewhere. Granted, I don't know about you, but I go to Safeway and I'm the only one in a mask.
Yeah, you don't see them that often these days. And the other factor that I want to talk to you about is long COVID. I know that you take care of patients who experience long COVID. There's still so much that we seem to not know about this condition. It does sound closer to a chronic condition like lupus or fibromyalgia, one of those conditions that seems to last long and have a myriad of symptoms. What are you seeing in your own patients, and what are some of your colleagues talking about when it comes to long COVID?
Well, I am seeing these actual patients, and I am very, very close to all the outcome studies and the data that we have across the country and across the world. And a recent study that we just had within the past 2 weeks came out, and it's highlighting, I think, what I can tell you that I'm seeing in my experience, which is actually a little bit of positive news. And it is essentially saying that very high percentage of the individuals with long COVID are resolving after 2 years. So there is resolution for, now, again, when you detail and rip those studies apart, there's specifics of, which conditions and which type of patient. And if you had severe lung damage or damage to your heart, unfortunately, that's not going to change. But the people that have the things like the brain fog and the muscle and joint pain and fatigue, which are the big common symptoms, those things will have a good tendency to just resolve with time. And I'll be the first one to tell you, we have some medications we're using for it, but the answer really is there's not a lot that's effectively changing that. But again, long COVID is a big group of patients and symptoms. And you almost have to differentiate out of that group people who had structural physical damage from either intensive care, hospitalizations that were hit by the massive vascular effect that COVID had, which is a lot of blood clotting. Blood clots, brain, blood clots and destruction of the lungs, blood clots to the kidneys and peripheral arteries. Those people, a lot of that has created permanency. And these people were living, maybe in their 30s and 40s as someone who would be 80, with a lot of peripheral artery disease. So it's two worlds, but there is some positive light.
Okay, but 2 years still sounds like an awfully long time to be experiencing what we have heard are pretty debilitating conditions. Do we know what the indicators are in terms of who gets long COVID and who doesn't? Because you just said 30s and 40s, those are not the 60 plus that you're talking about in the earlier part of our conversation. What are the indicators that you could experience long COVID, or do we just not know?
No, we do. We do know that if you fall into the category of having more risk factors that I described earlier, your chances of getting long COVID are a little bit higher. And this one's black and white, unvaccinated, long COVID at a higher percentage versus vaccinated. So those are two pretty black and white, repeatable data points and studies that we have, that those are the risks. And that is the problem, Yanchi, that you can be in your 20s and 30s and have a perfectly normal health history and not be overweight, but you can just get devastated with long COVID. But there's still not enough data to predict why that has occurred.
Wow.
For these people, again, you'll look at certain subgroups and say, well, of course you got long COVID. Look at you. You're not healthy. I've been taking care. But we just have far too many people that have long COVID that shouldn't get it. And most of what we understand, it's, again, what is this? Why is this disease different than the flu, which I hate to hear people even comparing it to the flu. It's not. It turns your immune system on overdrive, and then your body attacks it, in such a short period of time. And so maybe some of these healthy people had such a healthy immune system that when it gets activated, it just comes and attacks different areas and sometimes the whole body.
You mentioned the bivalent booster, which is now available for folks with who are immunocompromised or over the age of 65. What about the rest of us when it comes to boosters? Are we waiting for the fall? Or,
Yes.
There's been a lot of talk about this combo shot, perhaps a flu shot that you receive at the same time or even in one dose. What are we hearing about where vaccinations for COVID stand? Because I think a lot of us, myself included, kind of don't even remember the last time I know I got that bivalent booster, but I know it was a long time ago.
Yeah, very interesting, very straightforward. We're going to have information coming up shortly on this. The committees that meet annually to determine the makeup of the flu shot. Remember, the flu shot has 4 components, so it's a quadrivalent vaccine. Every year, a committee meets through the FDA and CDC to determine what flus we're guessing are going to come out the next year based on what's passing around the world through the Southern Hemisphere, usually now. And essentially, they have already come out with a public statement that said, we will use that same committee, the same detailed analytics to study a COVID vaccine. And so we all absolutely know sometime early in June, we're going to get an announcement from that committee to talk about the timing of a vaccination that will come out paralleling the flu. So we expect, I can almost tell you it's a guarantee, that there will be a COVID vaccination available at the same time as the flu release for the entire population of the United States at all age groups, with some specific recommendations. We recommend this group higher and this group, maybe the teens. If you're healthy, you don't have to, or whatever. But there will be a COVID vaccine available. Now, here's what the question is. I think the last time I talked to you, it was driving towards the fact that they were saying that the bivalent is very likely going to be that vaccination. What is in the bivalent? Remember, the bivalent has the new Omicron vaccination, but it also has the original vaccination. So it still carries the same thing we all got way back at the beginning. Well, there's some question now immunologically whether the original variant from the Wuhan variant and things we put in the original, the way it's affecting our long-term immune system may not be the most beneficial or necessary. So we're all kind of watching that they may just move it to the Omicron-based variant and drop the original one, because that's that's old news. It's like the what was in that original one doesn't have much to do with what we're being exposed to now. But I will tell you, you're going to be able to get one in the fall. Okay. Oh, one other question. This is very important. The other issue that's very important, and I do this every single day, the new guidelines that came out for the bivalent 65 and above basically also have an important paragraph that says, but it's also up to your doctor and provider to determine if you need the vaccine. So your doctor can determine that some people that are not in that age group but at risk are allowed to give you the vaccine. So really, there is a pretty wide open category to say if your doctor's up on this. And, again, if I have a patient that's significantly overweight, has a lot of health issues, has had recurrent pneumonia and lung disease, I don't care if they're 40, I'm going to give them that vaccine because it could be, life-saving.
Mm-hmm. We did mention off the top that you run clinics in the Southwest and that you help to, test folks who are coming in over the border. I wonder if you could give us a snapshot of what's happening there and sort of what you're tracking nationally and internationally, because, Hawaii is an international destination. Summer's coming up. A lot of us will be traveling. What concerns do you have about what's happening outside of our state?
I think there's a lot of locations, if we go worldwide, that you'll have some countries that have slightly higher numbers, have slight different new variants that are tracking some of the new variants that we were watching and really concerned about, that like the XBB.1.16, it kind of plateaued. We were thinking it could rise. And so a lot of the countries that started to have rises that were concerning and doubling have kind of leveled out. So we're not, and there's a couple new ones that are now being watched over the last 2 weeks. And that's how active this is, Yunji. I mean, there's data analytics on the variants, that we'll be following over the next every week you have to follow it. If you go across the United States, we have some states that are a little more, are a little higher than other states. But you know what? In general, we're all kind of in the same phase as Hawaii. We're all having where people were fairly apathetic. People were like looking at COVID in the rearview mirror. And I'm seeing across the country where we still do a lot of vaccinations. The vaccination rates have just plummeted. People don't want to get vaccinated. The amount of testing is way down. The number of states that now with the emergency proclamation that are even producing data, very little. It's starting to drop. Counties and things, it's so complex where counties and states are now not mandated. So I have a big concern about that, Yunji. We're driving blind. But the country, we don't know. And it will be weeks and weeks afterwards before we know. And you got data, you got statements coming out of the CDC that's saying, well, we're going to watch the wastewater surveillance. Okay, that's not perfect. And then they say, well, we'll also watch the hospitalizations. Well, what's the problem with that? Those are lagging indicators that, and wastewater is plus or minus, but, we are as a country now flying blind. And that's why I've emphasized to you and everyone, they've laid it on our shoulders as individuals. We have to be the ones that protect ourselves and family.
Okay, so in that same vein, if you do contract COVID, if you test positive at home, because that's what most people do these days, they're not doing it through PCR through their provider, they're testing positive at home. What are the initial next steps? What do you suggest people do? Let's talk a little bit about Paxlovid and some of the things that you can do to help protect yourself, especially if you are high risk.
Okay, so I'll use a perfect example since I'm I understand what's going on at the Hilo nursing home. That's a high-end issue. Older patients at risk. Every one of them has been treated. They've either gotten Paxlovid if they can take it, or IV remdesivir. 3 days, a little more challenging, but it really works. That's what we would usually give, for people initially admitted to the hospital. Unfortunately, those are the only 2 things that work. All the other monoclonal antibodies have lost their effectiveness against Omicron. And, we're going to look back at this, and we're going to look at the amazing effects of Paxlovid. But again, what I can tell you, it's not being used enough, and people don't seek it out. So from my perspective, if you are in that risk category, if you're definitely over 60, call your doctor. You should be able to get you Paxlovid. If you're overweight or you have those health risks, get on Paxlovid. Don't take the chance. 90% reduction of death and hospitalization, and it still works, and it's available. It will be covered by your insurance, but you should get it. And then if we have elderly patients, I would, someone that's just on the edge where you even are worried Paxlovid might not be enough, there should be a push to get remdesivir.
Okay. We are just about out of time. I'd love to give you an opportunity just for a final thought. We are in this weird limbo period where, it does feel like, what are we doing? When did I get my shot? Am I worried? Do I wear a mask? I can go to the hospital and not wear a mask now. It is very confusing. And then you brought up, those data systems. Once those kinds of data systems are stood down, I would imagine they're very hard to stand back up again unless we reach a really critical phase. It just seems like we're not going back to that. So what's your final thought this morning?
The final thought is I want to reemphasize with kind of the masks more recently in the news. The data is crystal clear. I could sit here and I could regurgitate and give you posts on studies that show again and again and again a good N95 really works to make this happen. Some of those other studies have just been totally discredited. So the number one thing I can say is skip up even from a surgical mask and get an N95. They're less than $1 now, but they really make a difference. The second thing I want you to do is to do your own fit test. And you put that mask on, and what you should see when you breathe in and out, you should see that mask right here, if you're wearing it correctly, will suck in and will suck out if your air is moving purely through the filtration. If you're pooched open on the side or above your nose, your mask isn't going to move because the air is coming out above and below. And guess what? It's also coming in above and below. One of the biggest public health failures, I think, in the United States was that we dropped, we failed so much on the masking. And, here we are mailing tests out to people to check after they've got diseases when we should have done like England did. Everybody in the country should have been getting 2 masks a week, and there should have been no way where you turned around where you didn't get a really detailed fit instruction to be able to put the mask on and to wear the mask. So masking is your key right now. Use ventilation. Maybe another show we'll talk about the CDC. Finally, 3 years after the pandemic, just came out with a ventilation guideline for indoor ventilation. And we could talk a whole show on that because we need the offices and the closed environments where people are together to look at and to use that ventilation and use it in your home. It's simple.
Well, yeah, and just, real quick, I know I said we're out of time, but we have like 1 minute. I do want to emphasize that because I forgot to ask you about that earlier. Hawaii is so temperate. It's such a nice environment. Open a window.
Yeah. Oh, absolutely. I've been saying that from April, May of 2020. Use the trade winds to your benefit and open a window and put your kapuna where the wind blows over their shoulders and blows away from them. So your breaths, if you're visiting family, are not coming into them. If not, use a fan and put a fan behind your kapuna shoulders and let the air blow out the window. Use ventilation to your advantage, and then have a get together outdoor under a big tent. But I would still even be outdoors under a tent because this is so contagious. Remember, Omicron is way more contagious than the other prior variants. Watch where you're seated. Use the trade winds.
Okay. Dr. Scott Miscovich, thank you so much for joining us this morning. We always appreciate all your knowledge that you bring to us. Thank you so much for being here.
Thank you, Yunji, and appreciate your work.
Always great to talk to Dr. Miscovich. He shared a number of insights on where we are when it comes to COVID. May 11th, of course, a big day when the federal government dropped a lot of the requirements and declared, that emergency declaration ended. With that, of course, went a lot of the mask mandates. It also went the mandatory free testing, so that a lot of healthcare providers don't provide, insurance doesn't necessarily provide those reimbursements anymore. A lot of those resources are going away, and on statewide levels, a lot of that mandatory reporting is going away. And so Dr. Miscovich sharing this morning that he feels on a data standpoint, we are starting to fly blind and we really need to protect ourselves. So what does that mean? If you are in a higher risk category, make sure that you do have access to Paxlovid, that you're checking whether or not you should be one of those folks getting that bivalent booster that is now available to those who are immunocompromised and above 65. If you do happen to contract the virus, he suggests making sure that you have access to Paxlovid, or in some cases, even the remdesivir IV, if it is a more serious case and you are more at risk. There are a number of resources that are out there. Again, he talked about long COVID and that he's seeing people who are very young who may have very mild cases, but then experience long COVID. We did get an update that says that there are some bright spots, that they are seeing more and more that the long COVID cases tend to resolve after about 2 years. But 2 years is an incredibly long time to suffer through some of these symptoms. So of course, name of the game is avoid this at all if you can. And in his estimation, if you are in a crowded area or in a setting where you are with people who are at risk, then make sure to keep masking up and make sure that those masks are actually fitted to your face in the right way. We appreciate him being on Monday. Ryan will be back and Kathy Betts will be joining us. She's leading the Department of Human Services. They protect the neediest in our community. So we're going to be talking to her about her goals in that position. We'll be also talking to her boss later in the week, Dr. Governor Josh Green will be joining us, and we have a bunch of great interviews coming up. So make sure to join us right back here on Monday for another edition of Spotlight Hawaii. Have a great weekend. We'll see you then. Aloha.